Welcome to episode 21 of the Vegan Body Lab podcast. I'm your co host, Gabriel, and today we're talking with Dr. Angela Solari, a plant based physician who uses lifestyle medicine and scientific research to create a positive impact for her patients. So, Angela, before the show, we were talking a little bit about your background. So, you came here to the States, I believe it was in 2022.
Yes.
Awesome. And you came originally from Peru. Like, what, I guess, inspired moving from South America up to the States?
Well, I was dating someone from here, so we were in my country for a few years, and then we decided to come to the United States and to establish in here.
Makes sense, makes sense. And were
Mhm.
you already a physician, I guess, over in Peru?
Yes.
Practicing over there?
Yes.
Got you, got you. So a little bit of kind of like transitional phase coming over to the States and just,
Mm-hmm.
I guess, setting up your practice over here.
Mm-hmm. Yes. Yes. Mm-hmm.
Awesome. Well,
Yes.
I mean, walk me through a little bit about your background. Like, tell me, I mean, like, what do you practice? Like, what style of medicine? What's it about?
So, well, everything started when I was in an internal medicine lecture, and one of the physicians he mentioned like we are actually plant-based diet animals that would benefit from this kind of diet. For me, was very weird because I've always thought like, yes, you need animal protein, and you need like all the different products we can get from all the sources are that are available for us. So
Mm.
I was like kind of like shocked or impressed. So I decided to do my own research to actually talk to him and tell him like, no, you're wrong.
That kind of
Yes.
backfired, right?
Yeah, exactly. Then I found the work from Dr. Campbell, and
Okay.
I read the book, I watched all his lectures, and I said, I think like I'm not sure like I can fight this decision, because I think like there is enough evidence to say like we actually thrive on a plant-based diet.
Right.
And that's when I started to feel interested about it. I changed into being vegetarian, but I did it slowly, like
Mm.
taking some animal products from my diet one by one. And then after,
When was this, by the way? When did this like all start to happen?
2012.
Okay. Okay. Wow. So it's been a bit. So about 14
Yes.
years for you. Okay.
Yes. So I was vegetarian for a few months, and then I jumped into vegan. And
Oh,
yes,
okay.
it's gonna be almost 13 years. Yeah, 13 years. Yeah.
Wow, wow.
Hmm.
Okay, okay. So you
Yes.
you went to just to make sure I understood you correctly, you went to kind of like it was a lecture and somebody was talking about like kind of like the plant-based
Yeah, it
diet?
was internal medicine lecture, and he
Internal medicine.
mentioned that. Yes, he mentioned like, well, we're really, really like vegetarians, and that's our perfect diet, or like
Oh,
plant based. And I was like,
yeah,
no,
like,
I don't
nah.
think so.
Makes sense. And so this was in Peru, right?
No, actually, I was having these lectures in LA. Yeah,
Oh, in LA. Okay, got you. So you're in
California.
LA. Okay. I was gonna say that would be very interesting, especially with kind of like the cultural background. That'd be like, my dad's from Ecuador, my mom's from Colombia. So it'd be kind of like I can imagine like in Cuenca in Ecuador, like somebody talking about plant-based diet. I'd be like, I don't know how like people would take that because it's just such a foreign idea. You know what I
I
mean?
know. Yes, absolutely. And that changed like my perspective about medicine, because then I started taking courses and certifications about it. And the more I read, like, or the more like I would implement it into my patients, I would see positive outcomes. And that was even very interesting for me. And the first time I think I did it with my mom, she had like an obstruction in one of her carotid artery.
Mhm.
And I remember I told her, hey, you have to change it. She went vegan. Then when she went back to the doctor and they studied her, like there was no obstruction in one of her carotid arteries. And
Oh,
that kind of made me feel good and
yeah.
continue doing all this. But yes, I mean, like I start like, I think like all of us, we start with ourselves, and then
Yeah.
we want to implement it with our siblings, parents, or close friends. And then you just expand little by little. I don't know if that was your case, but in my case was like
Yeah.
that.
Well, I mean, it's huge testimony for your mom because I mean, I don't
Mhm.
know about you, but I mean, some of the older generations aren't always as open-minded or coachable, kind of like willing, you
Yes.
know?
Yes. It's hard. It's hard. Yes.
Yeah. Yeah.
Yeah.
But I,
Mhm.
I think that is interesting the way kind of like you framed it. So you were vegetarian for a few months, you kind of like you learned, had some insights, started doing some research, then you went
Mhm.
full on vegan, and
Mhm.
then you started bringing this to your practice, started like kind of like implementing with some of your patients, a
Mhm.
few family members. So I
Mhm.
mean, kind of like what was next after that?
So after that, I got the certifications, and I wanted to have the experience here in the United States because I have been following Dr. Barnard from long time. So I did clinical rotations at Barnard Medical Center,
Mhm.
and I was able to meet with Dr. Barnard. That you probably have heard of him. He's
Of
a really
course. Yeah. 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 Big,
yeah.
big name.
And then
Yeah.
I remember being like the night before, it was like you're gonna meet like this big star because everybody has like like yeah, my singers, the actor. I was like, oh my gosh, it's doctor. Like,
Yeah,
yeah,
yeah.
he's
It's the
very
plant-based
nice.
doctors.
Yeah, all and Dr. Loomis, they're very nice people, and they allow me to see what I was already seeing, but in the United States, because that is like here it was like a stronger movement, and that's
Mm,
something that I did have, or it was a challenge for me, is what you were saying. Like I felt like I was one of the few physicians who was saying, "Hey, do this, change your diet. You don't have to stick with all these medications all this time."
mhm.
And not everybody was receptive. So it was
Right.
kind of nice to come in here and be able to do clinical rotations with them and experience it firsthand with people who are already working at that for a long period of time. Because I think he started his clinic in 1986. So
Okay.
it was like a long time
Wow.
ago. So
That's yeah, that's quite a bit of
yes.
time. Yeah, yeah.
Mm-hmm.
Got you, got you. So
Yeah.
clinical rotations and then
Mhm.
so your particular branch of medicine is what?
Lifestyle medicine. Yes.
Lifestyle medicine. Okay. Okay. So just to kind of like get a little bit of understanding of that, I mean, how does that work? I guess if I was a patient and I signed up with you, I mean, how would that look like?
So first of all, would go through all like your clinical history, try
Mhm,
to understand what's your diagnosis, if you're taking medications, and also in my when I do it privately,
mhm,
because I still have patients from Peru through video telemedicine. We call it telemedicine, so
mhm,
video
mm,
calls. So I do ask a lot, like what's the scenario that you live day by day, and what
mm,
factors are you know influencing what you do, because the difference between someone who only practice medicine based on pills, it's like you can be 15 minutes with a patient, think about
mhm.
the diagnosis and give them a prescription. You treat patients with lifestyle medicine interventions. The longest I've been is 3 hours.
Wow. Wow.
Hard to understand the scenario in order to make changes into the person. And sometimes it's very complicated. And I
Mhm,
remember that time I had to talk with the daughter and then with the son and my husband so they could understand why she has to change it. And everything we already know as vegans, like all the studies we know that they're important, the Chinese
mhm,
study, Advent Health study, or the EPIC study that we talked before we
mhm,
start doing the podcast. I think it's important, like all the family members or even the patient is very grounded in what they are going to do and how is that going to impact your health, to the
mhm.
point to take out of your list the diagnosis you have.
Right, right. Because it's like you're actually trying to get to the core root of it.
Yes,
Like
yes.
versus like you've
That's
said. Yeah, like versus just giving like a Band-Aid solution.
that's the challenge, because sometimes I've had in the clinic, sometimes patients, they don't want to go to the root cause and they tell you I'm not going to change my lifestyle, so
Right.
let's go with the
Yeah.
pills.
Right. Right.
Sadly, I feel
Yeah.
that, but at the time I understand that there are other factors that they don't want to modify, or they
Yeah.
are too, like it's like their old culture is there, they are not willing to change it by now. They are
Yeah.
not willing to change it, so they're just going to stick with it. So I rather give them something than nothing.
Right. Yeah. Yeah. It's like, you can lead the horse to the water, right?
Mm-hmm.
Right. And
Yeah.
it's like, it is kind of amazing, and I guess in one side, I mean, I can understand because I used to, be quite fixed minded and kind of like closed minded myself. I mean, even, before I changed kind of like some of my lifestyle choices, including my diet, including kind of like my health choice and things. I'm like, wow, and I think part of that is fueled by like lack of awareness, just ignorance. So you kind of like
Mm-hmm.
think it's like this is the way it is, right? Like my
Mm-hmm.
parents, my grandpa, or it's kind of like I think I had this conversation a few days ago. I was talking with a naturopathic physician here on the show, and we were talking about epigenetics, right? And it's like you can have certain genes like turn on and express themselves, but your lifestyle determines that. But some of us just think like, oh, everyone's had cancer in my family, so I guess I'm gonna just have cancer too, versus kind of
Mhm.
like taking ownership of that actual like process.
Yes. Yes. Yeah. It's like they think, or most patients think, if my parents, grandparents had this, I'm going to develop it and it's part of my life and that's it, right?
Yeah, it makes
Yeah.
sense. Yeah, it's very kind of like just I would say like not destiny based, but it's kind of like yeah, you're just kind of like leaving it just a chance, like whatever,
Mhm.
right? Versus
Mhm.
kind of like oh, I could actually do something about this.
Exactly. Exactly. Yeah. And the way I see it is also like it's kind of sad, like that, like we put all this money in these non-communicable diseases like diabetes, hypertension, coronary artery disease, most common cancers, prostate, breast cancer, colon cancer. And there are other conditions like genetics diseases that we could be also focusing it, because there are people, there are a small population, but they need this help,
Mhm.
and these are reversible, and we're not doing anything for people that would really need us, because they had this genetics condition that is hard to deal with.
Yeah.
And we are just focusing on the other one that each person could take care of. Sometimes I see it and I feel like this is sad, because there are
Yeah.
people who really can't, like, it's not lifestyle related.
Right, right,
It's
right.
something like each person can do. And also, it's sad to know, like, they don't see this. And when they don't see all these solutions, that they go through all, the sadness or the loss of family members. Or I had a patient once, like, she felt like by reducing her hemoglobin A1C, she had diabetes. So
Mhm.
she wanted to reduce it to avoid the complications. She reduced it, but she was using all these animal products. And then still she developed peripheral artery disease with ulcers, which means like she was having the complication of the small arteries of her legs and toes, and she was a candidate to cut her leg,
Oh my
so
god.
she wasn't doing it. And I was like, oh my gosh, why did you do this? And she wanted to do lifestyle, but she didn't hear the right message. She just
Oh,
thought, okay, I'm gonna cut the carbs, and then I would have high levels of glowing a,
oh my gosh.
like, sad that it's so simple. And that's why I'm here, because I want to promote it more and more, because
Mhm.
the more people listen it, the more people question it, they're
Mhm.
going to do what I did. So like, you're going to go into the research or like the
Right,
papers and the scientific evidence and say, okay, I think that doctor is not crazy as I thought. That's what
right,
I thought. It was because
right, right.
I wanted to challenge him and I couldn't say, okay, he's right, right? We have to go through that process. That's the way it goes. Yeah.
Yeah, yeah, no, that makes sense. And I mean, we both can relate. I mean, I'm not quite sure how you experience your childhood, but I mean, my understanding is like predominantly like South American culture. I mean, I know Colombian culture, Ecuadorian culture is like very high in kind of animal products, especially the high fat animal
Mhm.
products, like salchipapas, chorizo. I mean,
Mhm.
even like things like, empanadas and arepas, sometimes
Yes.
they'll stuff it with cheese and meat and stuff like that. I mean, growing up, like that was one of my favorite foods, but it's like, it was just like, there was no awareness. There was no education basically. Like nobody was talking
Mhm.
about that. And that, then
Mhm.
it's like looking back, it's like, yeah, my dad got diabetes, I think when he was in his early 30s, younger than I
Wow.
am now, like in his early 30s. I'm like, what the heck,
Wow.
my
Yes.
mom got, cancer in her like mid 40s, late 40s, and it's like,
Um,
what is going on here?
mhm.
But then there's kind of like nobody's talking about, like you said, like the evidence-based research, like what
Mhm.
actually has been around for decades. Like this isn't actually even
Yes.
something new. And actually, I mean, if we're really being honest, like yeah, the Western world is kind of like getting more aware of it, but like even the blue zones, like most of the areas in the world where like the most long-lived humans, they may not be 100% vegan, but gosh darn it, like they're eating like pretty much very like kind of like whole food based diet, right?
Yes.
Maybe like minimal amounts of like meat or dairy, things like that, minimal
Mhm.
to zero amount of alcohol, but like a lot of kind of like whole foods from the soil, which is
Mhm.
it's just interesting, kind of like thinking that. I mean, guess how did you experience like growing up for your background?
So yeah, I mean, in Peru, we also have all the all the different meals you just mentioned. However, we do have a lot of like lentils, rice with like a protein that it would be like chicken, fish, or maybe a steak. In my house, it was very common to have legumes. So in that way,
Mm,
I didn't feel it wasn't like so hard because I always had beans, lentils,
Mhm.
rice, potatoes. But it is true, like many people in Peru eat what you just said, especially if they are with their family and they want to enjoy it, they will consider it like very tasty food, like
Yeah.
to have salchipapas,
My gosh.
like,
Yeah.
yeah, or French fries, or then
Yeah.
we have like this roasted big chicken, like everybody loves, and then with French fries and
Oh my
salad,
gosh.
but the
Yeah.
salad is this size, and
I
then the
know, it's crazy, right? And I remember I used to walk in the I was living in, Cuenca for, like, 6 months, and I remember
okay,
going down the street, and you know the vendors, right? And they're selling the meat and salchipapas, and I'm like, "Oh,
yes,
yeah, let me get salchipapas, it's so
and a
good."
hot dog,
Oh,
yes,
and the hot
you
dog, yeah,
know,
oh my gosh, and
or
then, like,
chorizo,
oh, chorizo, oh, no, of course,
yes,
classic, right? And then it's like now you go into kind of like the research about processed meats, it's like, "Oh my gosh, it's like carcinogenic." It's like, "Oh
yeah,
crap, this is, like, terrible."
yes. Yes, yes, it's equivalent of like smoking cigarettes, which is crazy.
Which is
And
crazy.
people, kids just consume them. Yeah. So yes, it's crazy. It's
Yeah.
crazy that there's no more awareness. And
No.
when you bring it into a conversation, especially with people, so I see people here like born here, but also immigrants. And I had a lady from Argentina. She said, I told her like, because she was taking like 14 medications,
Oh my god.
14.
Oh my
And she's
god.
like, I don't want to take it anymore. So
Sure.
when I heard that, I thought, okay, there is my opportunity to
Right.
bring
Yeah.
plant-based diet into the conversation. So
Sure.
I told her, well, you have coronary artery disease, and all you have here is just the build of like saturated fat, cholesterol.
Mm.
Cholesterol specifically comes from animal products, and
Mhm.
then all pro-inflammatory products from all these other metabolic processes. But she was like, "Oh, but I have to give up a steak. I enjoy it. I'm not gonna do that. My cousins are vegetarians and they are crazy. Probably you're crazy too." So, okay.
And then we get
So
put in the
okay.
crazy category. Yeah.
Yeah. So
Yeah.
and I was like, okay, I'm actually vegan, but I just wanted to help. Okay.
There's a
Just let
surprise,
her go.
surprise, and then it's like,
Yeah.
yeah.
I just let her go. Say, okay, we'll continue doing this. Try to implement
Yeah.
more vegetables because that we know that vegetables are anti-inflammatories. Increase
Sure.
it. If
Sure.
you want to keep it that this way, I can't do anything else if
Yeah.
she's not willing to give me the green light.
Right, right. Makes sense.
Yeah.
Well, I mean, you mentioned already a couple times right there, inflammatory, kind of like
Yes.
pro-inflammatory. So, I mean, so what are, I guess, the quote unquote inflammatory foods that, you know, we probably shouldn't be having, especially if there's kind of like chronic disease or kind of like chronic conditions at play.
So animal products are one big of. So we know all animal products can trigger inflammation in our body, especially because we cannot digest them the way we're supposed to. And also processed foods,
Yeah.
and not only processed foods like that, like chips, but also if we talk about like candies, because that's the other thing. When I talk
Mm.
about vegan, I say, okay, vegan, you're having a Coke. It's like, okay, no, it's not. Yeah,
Oreos and Coke.
yeah. I mean, it's vegan, but
Yeah, right.
it's not really whole food. So I'd rather
Right.
have you a juice, like a green juice, right?
Right, right.
So I think it's also important to mention, like, we're talking a whole food plant-based diet. We're
Mhm.
not talking about, I don't know, maybe you can just have sugar as candy, but
Sure.
that's not gonna be healthy for you,
Makes
right?
sense.
Because that's gonna create like peaks of sugar in your blood, and
Mm.
that's gonna affect your organs and everything, right?
Makes sense. Makes sense. So we got animal products, we have processed foods,
Processed
and then
foods.
you also mentioned like candies or kind of like I guess processed sugar as well.
Yes, yes, or so, yes. Anything that didn't come from the earth directly, you can tell like it will be pro-inflammatory.
And the reason why, just to make sure I'm understanding right, is because it's I guess foreign to the body. It's like, it's not
Yes. So it's all the chemical products that are not really natural for us. So
mm,
we're not this to begin with, animal products were not designed to eat. So we are meant to be herbivorous animals. So we have long intestines. And the reason why we have long intestines, like we can process all plant-based food, which have fiber, and then we
mm,
can absorb different nutrients. And another thing, like most people don't know is that before, because we used to eat very raw food or more natural food,
Mhm.
like it will be related to the soil. And we had like a source of B12 in a natural way. So many people would say, yeah, but where are we going to get our B12? It's
Right.
from animal. No, but in the old days, because things were less clean, but
Mhm.
less
Like,
chemicals that we would use.
depleted, like,
Yes.
depleted, right.
Depleted. So we were able to have all our nutrients from the earth. Now, if you notice, someone who eats meat, or also I know based on physiology, is like we take 18 hours to process meat. So
Mm,
18 hours of a product that is not natural to our bodies. That
18
also,
hours, 18
yes,
hours.
18 hours.
This is crazy.
Yes, but that's why I don't know if you remember when you weren't vegan, but you would eat a steak because you were with your family, and you would feel
Right.
like, oh, I'm super full, like I have no energy because all your blood flow is going there trying to process all that meat,
You know, I
which is
always felt
so.
like I wanted to take a nap sometimes even.
Yes,
Yeah,
exactly.
right? I just kind of like
Yes.
thinking like I used to go to my abuelitas in Queens, New York, and we would go there. And, obviously, Colombian food is delicious. It's amazing, and she made all the food usually from scratch. But,
Yes.
a large chunk of it was usually, like, some sort of kind of like meat-based dish. Yes, we had vegetables. Yes, we had kind of like, our potatoes and stuff. But man, I was felt heavy.
Yes, absolutely. So it takes too long, but for a intestine that is not meant to process this kind of food. And when you try to compare us with other animals like lions that they have short intestines and
Mhm,
like they have all the enzymes, and you don't see that the animal products causes disease in them like they do in us. That's
mhm,
another thing that is very interesting to point out,
mhm,
that these carnivores,
mhm.
they do thrive on a carnivore diet,
Makes
like
sense.
versus humans who developed non-communicable diseases. But
Mhm.
when you use the right diet, we are able to reverse it if it's in the point that it's not too complicated,
Sure.
or even improve the prognosis of the patient. So
Wow.
that's very interesting. It's important to consider, I think.
Makes sense. And I mean, that's basically plays into kind of like what you do for lifestyle medicine then.
Yes.
Is there any I guess because you've been plant-based vegan now for, close to 13 years. I mean, over your years as a physician and researcher and kind of like diving into this yourself personally and also, with your patients, has there been any kind of like specific research or, scientific evidence has like kind of like really stood out to you? I know you mentioned kind of like Campbell was like early on for you and that kind of like lit the fire for you. Was there anything else? And feel free to share about Campbell as well. But I mean, in addition to Campbell, was there anything that kind of like really stood out to you? I was like, wow, like this is like really concrete evidence right here.
Yes. So first was Dr. Campbell. I really find his research very interesting. Then it was the Advent Health, where they studied all the Adventist population in the United States and Canada
Okay.
for several years. It was between 7 to 10 years. And they noticed, they classified into different groups. They had the vegans, lacto vegetarian, pescatarian. And they noticed an important reduction of the risk of non-communicable diseases. The one that actually made me think more about it, it was type 2 diabetes, because sadly, many people here develop type 2 diabetes
Right.
after their 40s. And they say, oh, I'm getting old.
Yeah.
But when we review these studies, like you see the vegans, they had like between 40 to 60% risk reduction in type 2 diabetes. The ovo-lacto vegetarian was like 36% less, and the pescatarians 28%. But that also impressed me because I said, okay, even if you don't remove all the animal products, you are
Right.
helping significantly these populations.
Yeah.
So I thought like, this is something that should be shared more. I don't know why people are not aware of that. And interestingly, there was another study that was done in Oxford. It was the EPIC study, where
Mhm.
they also did something similar, but it was done in Europe. And they noticed how like colon cancer was reduced, coronary artery disease was reduced as well. So the thing that made me feel like, okay, this is important is like when you do studies and you see that they are done in different parts of the world with
Hmm.
very similar results, you see, okay, this is something I can trust. So
Right,
I,
right.
I really, I really like that one. I mean, I really like finding this kind of studies. And I know like in 2023, there
Mhm.
was also meta-analysis. Meta-analysis, I don't know if most people know, is like the study of studies. And
Study of a study.
they
Okay.
took many, like, it was like 2 million plus people that they were taken from different studies and they showed the same results. And here in the United States, when we do the assessments where we write the diagnosis of the patients,
Mhm.
there is one for reverse diabetes reversal or diabetes resolution. So it means like a
Okay.
patient was on diabetes, was treated with plant-based diet, and now it's free of it. I don't know if you've heard of that.
It-
Yeah, the American College of Lifestyle Medicine recently, I think 1 month ago, he created this code because now people are improving. The problem is like not everybody knows.
Oh,
Yes.
wow.
Mhm.
Wow. So this is wow,
Yes.
this is amazing. So you kind of like you have the obviously diabetes, you go through, whole food plant-based diet, and then it's kind of basically you're basically healed, like you're
Yes.
resolved.
Yes.
Wow. Wow.
Yes.
And this is the stuff that, nobody's
Yeah.
talking about.
No, they're not. And it has been implemented like I think 1 month or 1 month and a half ago. Yeah. Recently. Yeah.
Wow.
Mhm.
Wow. Well, so you obviously believe that lifestyle choices they're
Yes.
important for determining optimal health and preventative measures are, essential for achieving long-term well-being. Is there or like what kind of like new things in the field of lifestyle medicine are you excited about in terms of like seeing shift over the next like decade or so?
So when I saw this new code, I was super happy because most physicians would say, no, this is like a life sentence. You have diabetes, you have to take
Yeah.
metformin, this is gonna be you might go into insulin. But
Yeah.
now that you're seeing that it's even changing to put a code in there and it's by the health department of the United States, for me that was really big. That's
Yeah.
something. And another thing that I'm very excited about is like I see more and more physicians like doing it, but also in the medical training, it's like it is implemented. So I'm really excited about that. Another thing is that the American College of Lifestyle also mentioned that it's not only the diet and it's the whole thing, right? Like you have to change your sleep pattern, you have to do exercise, you have to, yeah, I mentioned the diet.
Mhm.
It's important to create connections with other people
Mhm.
and also to manage your stress levels.
Mhm.
Because if you don't do all of these things together and avoid alcohol and drugs, it's like everything is gonna fall, right? So
Right.
I like the emphasis is in doing everything. It's not only like that diet. Because if you do the diet but you are stressed, you consume alcohol, you're not
Yeah.
sleeping well, you're not gonna get any benefit. So
Sure,
it's
sure.
interesting to see like they are
It's
emphasizing.
multi-layered. Yeah, yeah.
Yes,
Makes
yes,
sense.
yeah.
I I'm gonna be honest, it just struck me right now, and I'm gonna use this as a unique opportunity right here. So I don't know if you can relate to this with your family. I know I noticed this with my wife's family. So Anna's from originally from Poland, and so I know her parents, like Anna will basically share some information, let's say about health or nutrition or something like that. Let's say, with a kind of like recent events over the past few years, right? Her parents are like kind of like close, right? Like, it's like no, like nothing's entered. But then they're very in Poland is very Catholic based, right? But then they hear a Catholic priest say the same thing that Anna was saying, and they're like, "Oh my God, this is amazing! Like we should do." And it just occurred to me that actually my dad actually, he's kind of similar too. So like I may share something with him. I'm like, oh, Papi, you should check this out. Like, this is good. Like, hey, this will help you. He takes the feedback, but it's kind of like, but then he hears something and it's like some like, I don't know, like it could be a priest, yeah. So it could be also a priest or like, some South American educators. Oh, this is look at this, like fasting or something. Like, Papi, like I told you that like 6 months ago. So actually,
Yes.
what I wanted to actually just ask you is that speaking to diabetes specifically, why is it that a whole food plant-based diet can actually potentially reverse and heal that permanently?
So what happens is like in type 2 diabetes, we have insulin resistance. So basically the receptor for insulins that we have, they don't work properly when insulin comes. So insulin is coming and we have the receptor. So the natural thing to happen is like it comes and then the receptor, they get together and
Mhm.
then insulin is released and the insulin takes all the sugar to the tissues where it's supposed to go. We eat animal products in these receptors. We're putting saturated fat in
Okay.
this area. And what happens is when you do that, because they're not working properly, so the receptor is not receiving the right signal, and it feels like, okay, I think I have to send more because I'm not really clear of what's going on. When it
Right.
sends more insulin, it's also making the beta cells of the pancreas to work more. So there is
Mm.
a dysregulation in the way it should work. And at the end of this process, because this happens several times, you are making the beta cells like tired or depleted of the natural insulins that they are supposed to work in harmony with the whole process. When
Right.
we eat a plant-based diet, even if it's lacto vegetarian, we're reducing the saturated fats that it comes from the products we're eating. And if
Mm.
it's vegan, it's even better because
Mm.
we don't have like saturated fat in a whole food plant-based diet. I'm making emphasis in whole food because
Yes.
then
Yeah,
people
and
eat.
and this is good because I think that kind of like the vegan term is kind of a blanket term, and then you can go get and I think they probably changed it recently. I think I was checking it out, but like Beyond Meat, for example, is like shoot, like their fat intake, I think it was like 20-25 grams, per serving. I don't know if that's specifically towards saturated fat, but I just know that, it's a higher amount. And I think that one of the insights that Campbell shared is like in general, obviously a whole food plant-based diet is the best for optimal health, but he also mentioned kind of like a lower fat, a little bit lower in salt, and kind of like things like that as well.
Yes, yes. So just wanted to finish my explanation. So when you use a whole food plant-based diet, you don't have saturated fats on the receptors. So it allows the insulin to work properly. And when you do that, so then the pancreas is not exhausted. It's sending the right amount of insulin and then everything starts working better. And the other thing is like when we have insulin resistance, the insulin is pro-anabolic, which means like it's increased fats, protein, everything. That's why people tend to start getting obese. So once
Mm.
you take that out of the equation, so you allow for the body to reduce the excess of insulin to work, these receptors work better, blood sugar is regulated, so everything goes back to normal.
That makes sense. And I
Hmm.
guess just playing devil's advocate here just for a second. I mean, the common concern or objection from people who have diabetes, I've heard this from my dad plenty of times. It's like, no, I have to cut out all the carbs. So like, for example, like he's like, okay, yeah, yes, I'm not eating any rice now. It's like, okay, Papi, okay, I hear you. It's like you probably shouldn't live on white rice, but technically that's not the core root of the problem right here, you know?
No, no. So the problem when we don't have that when we don't have like the perfect regulation of insulin is that the sugar levels in our blood goes up, right? And
Mm.
it's this sugar that starts damaging all our organs, like our eyes, the kidneys, the peripheral arteries, the heart, all of that. So when they think about the disease, they are just thinking about how do I decrease the sugar levels, but they are
Mhm.
not going to the root. So
Right,
the
right.
root cause is what I just discussed. So if you go to the root cause, you can reverse it. If you just think about one of the variables, in this case, sugar,
Mhm.
you're just gonna use, like we talked before, like just a bandage and
Mhm.
okay, you just decrease your race, but that's not gonna fix the problem because the problem is not that you have high sugar levels in your blood. The problem is that the saturated fat is messing up with the receptors of insulin.
Brilliant. Brilliant.
Hmm.
So now anybody listening to this, including my dad, who I'm going to forward this to, will now know this is the core root, right?
Hmm.
And I think that's basically what you're suggesting. Like that's what's missing in
Hmm.
lifestyle or in, I guess, in general allopathic medical practice, I guess, as you
Yes.
would call it, right? That's kind of like the missing ingredient is actually let's go to the core root here.
Hmm.
And it's actually just see what is causing the cancer? What is causing the diabetes? Like what's causing the heart disease? I mean, heart disease basically should be non-existent, right?
Exactly. Yes. And interestingly, we know that in Asian countries, it was non existent until we start putting all these animal products over there, right? Which is sad.
Specifically with heart disease?
Yeah, I mean, like before, I don't know if you remember in the China study and all,
Mhm.
Dr. Campbell's work, he would say like, yeah, if you go to China, you didn't have heart disease. Like
Yeah, yeah.
people were not like even overweight,
Right, right.
and they were eating rice every day.
Yeah, oh my gosh, and I think I remember one of the key findings from the China study was, like, he went there and they were so freaking astonished because they had never seen cholesterol levels so low, and they
Mhm,
thought something was wrong. They're like, "Holy crap, this is not normal because our normal cholesterol is, like, I don't know, like, what was, like, 190, 200, something
mhm,
like that, and they were
mhm.
seeing, like, numbers at, like, 130, 140, 120, and "No, something must be wrong here, right?" But it's like, "No,
Mhm.
actually, that's just normal cholesterol for them." Like,
Yes.
we had normalized living at such a high level, you know?
Exactly. Yes, 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 yes. And also, like the BMI. So people are skinnier is that is because they are having like a normal physiology, right? And
Mhm.
I don't know if you've heard, but I remember Mac- Dr. McDougall passed away in 2024, which is sad. But I remember in one of his lectures, he would mention, yes, also like the BMI that we're thinking that is normal is not necessarily normal. It depends on each person, of course. So sometimes you would see like someone who look overweight and it has extra fat. It might be like in the regular one and it's not good, you know?
Right. Yeah, that makes sense. Yeah,
Yes.
it's kind of like doesn't tell the whole story, so to speak.
Yes. I don't sometimes I do see like physicians like seeing a person and they are like in multiple drugs and then they are stable, but you see the person is walking with limitations and it's like, oh, you're in excellent shape for your age. And I'm like, oh, okay. I have to breathe and let it go because not
Right.
everybody thinks like me. And I understand it.
Yeah.
I understand.
Yeah.
But for me, it's like the best you can be. I mean, in terms of like physical activity, emotional well being,
Mhm,
connection with your family,
mhm.
and how you're independent. What's the point of being 90 if I don't remember my family member, I don't enjoy life,
Yeah,
with
yeah.
all these medications, people get to be very old, but under what situation, right? I don't know.
Yeah. Yeah. It's like, having good quality of life, like
Yes.
our whole life, not just for like
Yes.
40 years and then it's like all
Yes.
downhill after 40s, right?
Hmm. Like I just mentioned Dr. McDowell, and I remember, but he passed away in 2024, 77 years old.
Mhm.
He had a stroke when he was 18, and that's what
Mhm.
triggered him to change his lifestyle because he was very Western kind of lifestyle.
Yeah.
And I was thinking, I was like, who, who can tell us like there is a like drug treatment that after you have a stroke, you're gonna live like 60 years.
Wow.
There are no pills that
No.
even after an MI or if you want to prevent coronary artery disease, that
Yeah.
complications like beta blockers can increase your longevity like 5 years. But I've
Mhm.
never seen a pill that would give you 60 years of life extra. And he changed his lifestyle and everything. That's why he became so passionate about plant-based diet. And he made it after a stroke in his 80s, 18 years old. I'm sorry, 18 years
18, yeah.
old. Yeah, to 77.
Wow. Wow. Yeah, it's like unheard of, right? Except like, the best medicine's always been around us, with plants, with exercise, with,
Yes.
connecting, mentally and emotional well-being as well. Yeah.
Mm-hmm.
Wow.
Yeah.
Wow. Are
Mhm.
you seeing kind of like lifestyle medicine? Like, is there a particular kind of like direction we're moving forward with it?
In what so
Or in kind of like how you see it unfolding? Like, are you seeing like more people are kind of like gravitating towards this kind of like practice of lifestyle medicine, or is this kind of like are we still in the early stages of this?
I feel like I became vegan like in 2012, the end of 2012, and through the year at the beginning I noticed like it wasn't something popular. For example, in my country, it wasn't popular, but
Mhm,
now there's more awareness, and I do feel like even for hospitals that are not strong in plant-based diet, they are considering lifestyle interventions. Or
mhm,
also, I know like for example, care would try to help more physicians who try to implement lifestyle medications or try to stabilize patient and not not letting them go back to the hospital, have or being in a crisis in terms of a diagnosis. So
Mhm.
I do see that, but I think it's because of that, because now they are understanding that the more early interventions we have, the better the outcome and the better quality we can offer to our patients. Yeah.
Makes sense. Makes sense.
Mhm.
I mean, in general, it sounds like it's positive and kind of
Yes.
like we're shifting in the right direction.
Yeah, and I've also noticed, like, for example, there is the European Lifestyle Medicine Association, the Australian Lifestyle Medicine Association. So there are other parts of the world that are also changing, which is good.
And
Yeah.
there's like a European equivalent. I think we were talking about this back and forth a few weeks ago, or maybe a month or two ago. There's like a European equivalent of the PCRM, right?
Yes, or also the nutrition facts. Yes.
Yeah.
So Physician Association for Nutrition.org. Yes.
Mhm.
They are in Germany, and
Okay.
they also extended. They have a branch here in the United States. But that's
Okay.
another thing. Yes, it's nice to see like other parts of the world. They are opening themselves to this new approach. Yes.
Makes sense. Makes sense. So kind of like the general theme is like people are more shifting, kind of like more open to lifestyle medicine, to
Yes.
basically what the research is pointing to and telling us
Mhm. To root cause of diseases. Yeah.
to root causes.
There's a still challenge in terms of like changing the chip, like you were talking about your dad. Like I
Yeah.
struggle with my dad too. I
Oh my
love
God.
him, but
Oh my God. I love,
when I
we love,
talk to him, he's like, okay, yes, yes, yes. But then when he's gonna order, it's like, oh, I want my chihokai with chicken and this. Was like, "Ah, dude."
hey, papi, no
Yeah,
escuchas nada.
exactly.
Like, say, like, what's going on? What happened to the conversation?
Exactly, exactly.
Yeah.
And I'm
Yeah.
gonna send this to him too, and
Oh,
he'll
perfect. That's
give
good.
me.
You listen, well, I mean, I guess with your family and the cultural background, so you've obviously kind of like navigated different kind of like areas of re-education, right? Kind of like I think on another episode I had with Brian Mirabella, he was talking about like basically we have to basically do a lot of unlearning, right? Like as we kind of like develop and grow up as adults, and it's kind of true in a way that actually most of what we learn is kind of backwards, right? It's like wow,
Mhm,
actually, yeah, probably what doesn't make sense for lifelong health, optimal health to eat predominantly animal products, right?
mhm.
Ethics aside, just for a second, just from a health based perspective, it's like yeah,
Yes,
probably doesn't make sense, right? Probably doesn't
yes.
make sense to be living with chronic stress, whether it's work or family or whatever, like always, like I gotta have periods of rest and rejuvenation,
Mhm, mhm,
not even talking about like mental and emotional well-being, like I don't even think
mhm.
that's discussed enough. Either one of those. It's just like, oh, prescribe, 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 or, take this. It's like we sedate ourselves with so many things, whether it's like food or drugs or television or, name it. You know what I mean?
Yes, and now we have the iPhones or the cell phones that we didn't have before. We didn't, for example, in my case, I didn't grow up with a cell phone, but
Mhm.
now kids are having that, and that
Oh my God.
affects your cortisol,
Yeah.
natural cortisol levels to go to sleep, and
Yeah.
these things add up to actually, yes, not necessarily impact us positively. And yes, yes, we have to consider all these things,
Yeah.
not only
Absolutely.
diet.
Well, I mean, talk to me about kind of like your approach to health and wellness. I mean, as a physician, as a woman who values her health, like, I mean, do you have a specific way that you kind of like prioritize your health and kind of like lead by example for your patients?
Yes. So my diet is very important. I've respected it for several years. I'm not gonna lie. Sometimes I've gone through stressful process lives. Things happen in life, so you
Yeah.
go through stress, and sometimes my sleep hasn't been perfect. But I do try to sleep like for in my case it's like 7 to 8 hours. It's the perfect amount. I
Mhm.
know some people can get away with 5, but in my case, it has to be 7 or 8 is perfect.
Mhm.
I try to always respect that. And then, yes, like if I can't go to the gym, I'm taking out Lily, who is my dog, and like I just walk around. So I'm trying to do exercise every day. Meditation, I'm trying to afford. I used to meditate a lot before, but and now because of my work's being a little bit messy, but I'm trying to push that again because
Mhm.
it allows you to just get back into your inner self. And it's that also important to calm down all your stress levels. And also, I try to do grounding. I recently bought like some grounding shoes So if
Nice.
I go out with my dog, I'm in the grass, I'm also grounding, so that helps too.
This is amazing, amazing. So would you say
Yes.
those are kind of like the core foundations for you?
Yes.
Makes sense. So you mentioned, so obviously diet, I guessing predominantly like kind of like whole food, plant-based diet
Mhm.
in general. Sleep, I'm hearing 7 to 8 hours, very important. I would definitely agree with that. Some sort of exercise, whether, if you're able to go to the gym, but at least moving, like walking every day. And we know walking, I mean, so many benefits of walking every day.
Yes.
And meditation, obviously, time allocation with your work,
Mhm.
and grounding. Wow, I love the grounding. Yeah, the grounding is
Yes.
one I think is not discussed enough. And I mean there's such a large body of research behind grounding in general too.
Yes, yes, absolutely. I think like before, maybe people used to ground more because it was like if we didn't have televisions or even like our parents, like they wouldn't stay 8 hours watching television. Like my
Mm,
dad would tell me, like I was playing football outside, and when you were outside, like you fell on the ground or you
yeah,
sit on the ground, you are grounding. You
yeah,
are
yeah,
just with nature,
yeah.
and that's allowing your body to feel better, to put everything, get rid of all the bad, like electrons that can be
Hmm.
dysregulating your
Yeah,
system. Yes,
right, right. The
yes,
the positive ions, as they talk,
yes,
they call them. Yeah, yeah, and another kind of like process that reduces inflammation as well.
yes, absolutely. Yes,
Yeah, makes sense. Makes sense.
yes.
Talk to me about kind of like what you're excited about in the health world and the health movement in general. Obviously, we have kind of like plant-based nutrition, we have exercise, but is there anything in general that you're excited about? Whether it's diet related or not.
So I've noticed not only in the plant-based movement, like even in, for example, psychiatry, like they are using lifestyle interventions to actually help patients. For example, you probably have heard like the gut-brain connection. We know
Yes.
like 90% of our serotonin comes from our gut. The microbiome is very important for us. And now even for depression, they are considering more plant-based diet, not only for depression, but if for mood disorders, it also helps as well. So I see like it's branching. That's interesting to see
Okay.
because most of the time we talk non-communicable diseases, but
Mhm.
now we see like it's moving towards something else. And also, I know for autoimmune diseases, we know that it also helps, right? We
Yeah.
know that there is a problem in not all the autoimmune diseases, but many of them. So there is a problem with the leaky gut. So when
Mhm.
our gut has been exposed to proteins that comes from animal products with different medicines that probably we didn't need, because
Mhm.
sometimes we do need medication. Like if
Mhm.
someone comes and it's in a really bad like urinary tract infection, it's an
Mhm.
elderly. I don't want to put an IV and put antibiotics, and he needs it.
Mhm.
Probably the best thing would have been to prevent it before to
Right.
his immune system is stronger, but at that point you need it. But what I'm
Right.
talking about is like sometimes like kids they just have a pharyngitis, it's viral infection, but sometimes I've seen that in my country. Like,
Mhm.
they demand antibiotics, but antibiotics mess up with your gut flora.
Right.
And
Right.
when you mess up with your gut flora, you create what is leaky gut. So it can happen is like the cells in your intestine, they allow to break the little wall that was between them. When
Mhm.
you do that, you allow like molecules or like little proteins that were not supposed to be in your bloodstream
Mhm.
pass or go through it. So what happens is that if that happens, there is your immune system will recognize these amino acids that come from animal products and will say, okay, this is foreign for me. But
Mhm.
also, I'm attacking it. At the same time, I notice I have it in another organ. For example, with many autoimmune diseases that related to your thyroid can be caused because there was this molecular mimicry between the amino acid that come from the animal products and the one that you have. And then
Mhm.
you are creating this autoimmune disease.
Sure.
So it's interesting to understand that we can address not only heart disease, diabetes, the most common cancers, but also certain kind of autoimmune diseases and help at least control. And in some cases, like you can take patients off of the medication. You have to see each patient individually. Not everybody is the same, but we
Mhm.
can help them. So what I find interesting is we're branching to different different specialties, which is
Mhm.
good.
That makes sense. I mean, wow. I mean, that's so exciting because it's kind of like as you're kind of like branching out, like, I mean, now you have the proof is in the pudding here. It's like, wow, like we already know like this is very helpful with, and just real quick, just to define non-communicable diseases, non-communicable, that's is like it's not transferable to somebody else. Is that what you're saying?
Yes,
Okay.
exactly. Mhm.
Okay, just to make sure I
Yes.
understood that correctly. But basically, what you're saying is like now this is now branching out to other specialities, like
Mhm,
autoimmune diseases.
mhm.
Basically like other health conditions, other health concerns.
Depression, mood disorders, yes.
Wow, wow. So
Mhm.
this is pretty cool stuff.
Yes. Yes, absolutely. Yes, that's exciting.
That is very exciting. Talk to me about, I guess, are there any specific like common concerns that you see more predominantly showing up with your patients, with the people that you work with? Is it like, are you predominantly kind of like seeing like, oh, she's like heart disease everywhere. It's like, diabetes, or it's kind of like, or is it just like so varied by every person?
No, it's concerning that here it's very common to see it's like it's just like I know like you just see someone who is overweight and you know like it's gonna be coronary artery disease, it's gonna be diabetes. That's concerning. And also what I don't like is like now with all these new medications to reduce weight, like
Mm,
people are using it and I think the problem is like they want to stop it, and if you didn't change your lifestyle and
mhm.
you're gonna go back. And I don't like that these medications are used when you can use something that is not expensive and it's so natural and it's so healing for our bodies. It's that's that's a part that is concerning for me.
Makes sense. Yeah, obviously as a physician, and you see, obviously a lot of people. I mean, we can open the can of worms right here. Yeah, I think this is like the first official podcast conversation specifically on the GLPs. So basically what I'm hearing is that um like it's not a permanent solution. Like, and my understanding from kind of like because I don't have so much research that I've done on it, but my understanding so far, kind of like from the surface layer research, is that they are quite effective in kind of like the application of them. But my understanding is that you have to stay on them like pretty much for a long time, and then the weight rebound rate the moment you get off is also pretty high as well, which doesn't really sound like we're actually getting to the core root then. Because if like you got to
Exactly.
you stay on a drug for a long, long time, it's like that doesn't sound great because we obviously know that. Well, like every kind of like commercial you hear on the TV, it's like, oh, here's a drug, and then like the next like 2 minutes is all the side effects, for
Yes.
that. But then the other part is like, shoot, when I get off of it, I still haven't like changed my lifestyle to still match kind of like retaining the results.
So yes, I mean, and it's not so great. There are people who started and they would tell you like, no, it didn't help me. I mean, I didn't lose anything. So they
Mm,
are putting something in their bodies like it's not natural. It's foreign for them.
right, right.
That's one thing. But the other one is also yes. I mean, what's the point of using a medication that is supposed to help you, but then the moment you leave it, it's like you're gonna go back and get sick because obesity is a diagnosis. Many people are not aware of that, but it's like saying type 2 diabetes, like saying hypertension, like saying coronary artery disease. They just think, oh, I have extra weight. Well, but we know that that fat in your body is creating inflammation and it's like putting more wood into a fire. Fat tissue does that.
Right.
So
Okay.
if
Got it.
and we know many of these diseases get worse with more inflammations. And the other part is like these medications are extremely expensive. Not really,
Mm.
like $1,000, $2,000.
Oh my god.
As
Monthly?
yes, yes.
Oh my god. Jeez. It's like a car payment.
Why are you trying this, not working, spend it when you just can't change your diet? I mean, why? And there
Yeah.
are people who are really like not in the best situation and they are putting all this money into it when they can do
Wow.
something that is way cheaper, no
Yeah.
side effects. And
Right.
you can use it for life and you're going to enjoy it anyway
Yeah.
because you start discovering different foods and different restaurants and different things that you're going to enjoy because I don't know if that happens to you, but at the beginning I felt like what am I going to eat? But then
Yeah, yeah,
you
yeah.
start figuring it out and you
Right.
enjoy it.
Yeah, yeah,
And
yeah.
it's nice.
Absolutely.
Yeah.
Absolutely. This is interesting the way that you're framing this. It is interesting how so many people will do everything in their power to basically keep their lifestyle the same, to keep their choices the same, albeit, okay, I'll take this medication, this drug, but lets me keep my lifestyle the same, like my choices the same. It's basically like, oh, this is a deeper psychological conversation, but basically, we're not going to the core root here again, and it's like, it must be so frustrating for you just seeing like you actually want to help people and it's like
Mhm.
people
Yes.
don't want to help themselves.
Yes, yes, yes. Or they don't see it. And also, again, as I mentioned in the beginning, there is not enough conversations about it. I think the more we talk about it, the more people will listen it, the more someone will tell a friend, a family member, and things will evolve, because if we are hearing on the television all the time, no, yes, use this magic Monjaro, or you can
Yeah,
use this magic pill to lose weight,
yeah,
like
yeah,
that's what they're hearing. And
yeah,
subconsciously it gets in there. So once you
yeah.
go to the doctor, it is offered, and then you
That's it.
just do it because you think it's right.
Right.
And maybe we would hear all the time, no, plant-based diet or do more science. If you would hear that all the time, maybe it would come more natural to you as well.
Makes sense. Yeah, it's the constant messaging, the constant
Hmm.
marketing that we hear, and like you said, it becomes subconscious, where it's like, oh, okay,
Hmm.
I guess that's the path forward, right?
Hmm. Yes. Yes.
Makes sense. Makes sense. Well, as we start to kind of like just wrap up here over the last couple of minutes, I mean, what new therapeutic or new nutritional or new kind of like lifestyle practices, or I guess you could say kind of like strategies, do you see kind of like evolving more over the next few years? Like, is there anything like we talked about, plant based diet? We talked a little bit about kind of like now the implications of that in other areas. Is there anything else? I mean, you mentioned you do grounding for yourself personally. Is there anything else that you see like, oh, this would actually be also just as helpful for the patients that I work with?
Yeah, meditation. I think meditation is important. And I've seen people talking more about it or growing into that. And I don't know if you've heard too, but also therapy with sonotherapy, like gong therapy.
Which one is this?
It's supposed to be like music therapy that you can use with
Okay.
so different frequencies can help
Okay.
you to, because at the end we're energy, right?
Right.
Also we're like all the cells have a frequency, work with different kind of electrons, but also like different elements, and each of them have energy.
Hmm.
So I've seen, for example, in certain hospitals, they're implementing this, which I find interesting, like music therapy.
Music
So
therapy.
they
Okay.
can, I don't know if the gong is like this one, this thing that is big and you.
Yeah, yeah, yeah. The gong. Yeah, yeah, yeah. Yeah, I know. No, no, I understand. So, but I guess I'm just unfamiliar with it. So it's called gong therapy. So it's some sort of like vibrational music
Yes,
therapy.
yes. So it can be, but what I've seen is like there are certain hospitals that they are allowing music therapy, and
Okay.
I found that interesting because I thought, okay, this is not another drug.
All right.
This is like
Yeah.
someone come in and based on what, and these people study to know like what kind of frequency they can use to
Hmm.
improve the prognosis of the patient in cancer, in mental
Hmm.
illness, or in like non-communicable diseases, people who are hospitalized. I've seen it hospitalized patients. I
Okay.
find that very nice. I thought, okay, this is good because now it's not only about an extra pill. It's about like,
Right.
okay, what else can I implement to make this better for the patient? But it's not an extra pill or
Right.
something that you put via IV. So
Yeah.
I was fascinated by that.
That makes sense. Makes sense. This is, I guess, a personal question. I guess, kind of from what I've understood and what I've learned about physicians. So you've obviously taken a very different stance to kind of like the, I guess you could say, traditional like allopathic doctor. My understanding is that traditionally, like allopathic doctors, like they aren't educated too much in terms of lifestyle, nutrition, things like that. This is kind of like something like basically they have to pursue out of like their own interest. Is that accurate?
Yes. Actually, in my case, that was the thing. I had to start doing my own certifications, and I started studying by myself, and I noticed and I felt I had passion for that. So like,
Hmm.
okay, just going to a different route. Now, the interesting thing is like there are hospitals that are implementing lifestyle medicine into their program, which I like, and I'm looking forward to moving to a hospital that is like that. But it's good to see there is like an open awareness or like an openness to implement this into the physician's practice. It's
Mhm,
very new, but
mhm,
yes, like for example, in my case, I had to do it like you just said. Like you have
mhm.
to pursue it by yourself. Yes. But
Ma
now it's changing. And we
that
know that we have the American College of Lifestyle Medicine that is also helping physicians to be educated and certified in this. And yeah.
makes sense. So there's kind of like we're moving, like there's a growing trend, like people are getting more aware, physicians are starting to get like, more resources available to them.
Yes.
But
Yes.
but in
Mhm.
general, I guess kind of like that's where you have kind of like the old guard where it's like, they're so used to kind of like it's just, pill, prescription, this
Mhm.
thing. And I mean, I guess in a way it's not like making them wrong because it's like all that they know,
Yes.
that's their practice, you know.
Yes, yes. And maybe something that would be nice in the future that they could change. I mean, when I talk about days like the system or the system could change is that so you're supposed to see a patient in 15 minutes. You can't talk about lifestyle. I mean, you can mention lifestyle medicine, but you can't change someone like lifestyle pattern in 15 minutes. So hopefully
Yeah.
I see this change in the future or like I'll change it starting by myself. I don't know.
Dr. Angela leading the way.
Yeah.
Yes, yes. So, wow, and that's incredible. Yeah, because like 15 minutes, like what can you do with that? It's
You
like,
can do in yeah, that
what do you do? Like, what do you do? Oh, like, hi, how are you? Oh, boom, you got this? Okay, well, here, take this. I'll see you later.
yeah, yeah, it's crazy. Yeah.
Crazy. Well, Angela, is there anything else that you'd find helpful to kind of like let people know to be more aware of? Anything else that kind of like closing thoughts here as we start to wrap up?
Yeah, I mean that if they're interested in the topic to try to reach you or reach me or like try to read by yourself, to watch the different documentaries that we know there are very help us for us, very educational, like for Knives, What the
Mhm,
Health. We also they can read the Chinese study. They
mhm,
can try to get into Physicians Committee for Responsible Medicine.org. It's a very good website. Nutrition Facts, also
mhm.
Physician Association for Nutrition International.org. Those are resources that are free, are out there and if they have questions they can also ask us or ask them. They're also always helpful, like they are always willing to help.
Absolutely. Yeah, there's such an abundance of like just
Hmm.
free education and free
Yes.
information. I know that you mentioned that you were like, one of your kind of like ideal outcomes was maybe, working at having your own like practice in the future. If,
Hmm.
if somebody wanted to like contact, they wanted to work with you, they just wanted to like, have a conversation with you, what would be the best way to do that?
They can do it through my Instagram or Facebook account. Is Hojas de Arce, but it's in Spanish. I don't know if they would
I'll make sure
understand.
I'll put it the links in the show notes. But
Okay,
but you
thank
said
you.
so yeah, you're good. So
Mm.
Instagram and then also Facebook would be the best
Yes,
places.
yes,
Amazing.
that would be yes.
Sounds good. Sounds good. So we'll make sure we'll get all the links in there. And definitely, I mean, from what I've just reflecting on today's conversation with Dr. Angela, I mean, I've really, really enjoyed speaking with her. And guys, reach out to her if you guys have questions. Angela has such a depth of knowledge, really in the trenches, working with patients, for a long time now. So, Angela, let's close out. If you could change the healthcare industry, let's say overnight, what would you immediately change about the industry?
So I think I would like them first to give us more time to, as I mentioned before, to see the patient and consider that the risk factors or diseases that the diagnosis that the patient have, especially the ones that we can change with lifestyle medicine.
Mhm,
Our first approach should be changing the lifestyle. And then if that doesn't work, the second should be go to maybe a medication that can help the patient. But should be like, what can I do first
mhm,
to help this patient? Like, if I find a patient, he has high cholesterol, okay, let's try a plant based diet for 3 weeks.
mhm.
That should be, I think that that should be something I would like to change. If
Makes
for
sense.
some, because there are other diagnoses that are not lifestyle related.
Mhm.
You could have high cholesterol because you have a genetic change in the receptors in your liver, and that's called
Okay.
familiar hypercholesterolemia. Okay,
Mhm.
let's use in that case statins.
Okay.
Let's try something that could be like more gentle with the patient first, and after that, we'll see if that doesn't work. Okay, we'll move into medication.
Makes sense. Makes
Mhm.
sense. So that those would be the 2 things is getting
Mhm.
more time, like actually just having more time to actually spend with the patients. And number
Yes.
2, you being able to use lifestyle practice methods to, support their life and their health.
Yes. absolutely.
Amazing. Amazing. Well, thank you for being on the show. Really
Okay.
appreciate you. Yeah. Thank you again. And hopefully we can stay in touch and keep talking about this in the future.
Yes, thank you for the time and the opportunity. I'm very thankful.
Thank you, Angela. We'll talk soon. Take care.
Okay. Bye bye.